Insurance companies will pay for them up front, or they'll reimburse you if you submit a claim. Now, Wednesday, you can order free at-home testing through the government's website, covidtests.gov. However, most people won't receive them until the end of January, just so you have a timeline for you there. The White House said tests will usually ship within 7 to 12 days of ordering. Dr. Sharif ELNAHAL is with us now. He's president and CEO of University Hospital in Newark, a former New Jersey health commissioner as well. Doctor, thank you so much for being here. I understand that 10% of your staff is out, roughly 300 people in various departments, and that is due to this pandemic that we're seeing at a time like this when I know it's already frantic and it's already so fatiguing for everybody there. Give us an understanding of a day in your life right now.
Yeah, thank you so much for having me. So yes, close to 10% of our staff have been out. We're starting to see a little bit of a downtick in that, and I hope that continues, and that's good news. But right now, our staff are pretty demoralized. They've been dealing with this now for 2 years. We continue to have our hospital admissions with COVID comprise 75% of them are folks who are completely unvaccinated. And so we do think a lot of these admissions are still preventable. But regardless, I think this is a really tough time because when we were first surging in the spring of 2020, it was sort of similar to an adrenaline rush. There was a light at the end of the tunnel that I could paint for cases hopefully going down. It's harder and harder for people to believe that as we go through wave after wave. And so because of all of this, the president's announcement just last week that we would be one of the hospitals receiving 23 women and men in uniform to assist us with staffing was just such a great piece of news. It was an injection of energy and morale in my staff, and it's something we really appreciate as we go through this difficult time.
And what are your most urgent needs there? Where do you see some of those people being placed? As you said, 23 military staff coming to help and support the help that you already have.
Unfortunately, we're short in almost every area of our hospital, but we have areas, of course, that are hit harder than others, our emergency room, our intensive care units, but also areas of the hospital that have critical roles that aren't directly clinical, but needed to move the hospital around. So transporters, environmental service workers, food service workers, we're short in all of those areas, very important, crucial jobs. And so there's going to be a lot of work to go around for these incredible heroes, joining, frankly, our heroes at the hospital.
You mentioned there the COVID patients you have. I understand there's about 150 COVID patients at your hospital. You mentioned that 75% of them are unvaccinated. Contrast for us the care needed for somebody who's vaccinated versus somebody who is not.
Well, unfortunately, it's really the same playbook for somebody admitted with COVID-19. The good news is that about 60% of them are patients with COVID, but not here for the classic COVID disease. So COVID pneumonia requiring intensive respiratory care, ventilator care, intensive care. That's only about 40% of patients with COVID in our hospital. And frankly, those are folks that are asymmetrically unvaccinated. And so, yes, if you're unvaccinated, you're more likely to get severe disease from COVID and require all the classic things we've had to do over the last 2 years. And contrast that with folks who are fully vaccinated or boosted. They may have the disease, but that's not why they're here for the most part. And so I think it's important to understand the distinction here and the value of vaccination, which is still really, really important, which is why we have a big role in our community here in Newark in spreading the word about it. We have a big vaccination clinic, and we continue to see demand for boosters, which is good news.
So I understand that Newark is an 80% minority community, and that you say you've been, quote, devastated asymmetrically for the last 2 years. Distinguish the problems that you see in your hospital versus perhaps others. Have you had conversations with doctors at other hospitals?
Yeah, I'm glad you're asking about that because our experience here is similar to other urban areas across the country, other majority-minority areas. More densely populated, more comprised by essential workers who have to expose themselves to this risk for 2 years now, asymmetrically over others. And we've been really impacted by this, and we've also been therefore experiencing, I think, worse staffing shortages on average than other hospitals that may not be serving such a vulnerable community. And so I do think it's really important that the Biden administration prioritized hospitals in areas of the country like ours. It speaks to their priority on health equity, but also where the pandemic has been hitting the most. And so I think it's an indicator, frankly, that this administration is listening to the priorities of health equity.
Dr. Sharif ELNAHAL, we appreciate all the work you're doing and taking time to talk with us about it. Thank you so much. Best of luck to you.
My pleasure.
Still ahead, a Russian buildup on the border with Ukraine. Some